the thymus gland I'm telling you. You want me to remove it? But there will be some specimens that still has it. There. This is the thymus gland. There. And then we can just remove this one too. This is a pericardial sac. And please do not just like pull out anything. You see this blue one coming out now? Okay. And like I said, do not pull out too much, because you see this nerve here attached to the diaphragm? Here. This is the phrenic nerve. You see that? It will be paralleling the heart, and it goes up to here, and there's also one in there on the other side.
The nerves on the cat, what
The
color are
phrenic
they?
nerve. Yeah, this one, the phrenic nerve.
What color do they look like?
It's like a light, and it's a thin one. It's like a thin red. You see this? It has two. Phrenic nerve left.
Oh, okay.
This is right.
Gotcha.
Okay, now
Like little strange.
I'm talking of the veins, correct? So this is now the superior vena cava, correct? The inferior vena cava is this one. The one at the bottom, inferior. And that inferior vena cava runs straight up to here. Yeah. No, the common ilia, yeah. So it's still inferior vena cava. Okay, that inferior is still continue here, that new big vein there. Okay, now, so we said that this small vein is where the thymus gland is attached, and it's called internal mammary vein, correct? So from the superior vena cava, it branches down into the brachiocephalic vein, brachiocephalic. The brachiocephalic branches going to the shoulder, and this is the left subclavian vein. This is the right subclavian vein. This is your right jugular vein. This is your left jugular vein, the one that goes towards the neck. See that? And like I said, if you're gonna really dig deeper, and then you can see branching of it. Where are the branching? There. We have branching of this jugular vein, then that will be the external jugular vein. So, that is the vein. Now, like I said, this dark one is the transversus abdominis, the innermost layer of the abdomen.
Oh,
Ooh, that's dirty. Can I have like a paper towel, please?
my glasses on too.
So like I said, pulls all the internal organs away from you. One from it. I don't know what. Oh, there's a blue one there. Okay, the one branching. Now, if we're going to turn this over the
Oh, she's to the renal thing.
Yeah.
Okay. Now, so the one on the left side is the aorta. This one. You see the aorta now? And from the aorta, the arteries branching from it are called the posterior intercostal arteries going to the ribs. Now, they are very tricky. And it's really hard to come up with it. You see this nerve here in between the ribs and the muscle? There's a nerve coming up here. You see this nerve here? That's called the posterior intercostal nerve. Okay, there. It's like a white thread. Okay, now, I will show you now the branching of the aorta. So, in doing that, you really have to push the veins a little bit. Isn't it? This is now the... So this is now the aortic arch. When it curves, is this aortic arch. What did I tell you? How many branches it has? 2. The first one is the left subclavian artery. The other one is the brachiocephalic artery. The brachiocephalic artery branches into 3. You see those branching now? You see that? Okay. Left subclavian artery, brachiocephalic artery. If this is the left subclavian, this is the right subclavian. This is the left common carotid. This is the right common carotid. Do you see the arteries branching from it? You see these 3 arteries now? The one on the left is left subclavian, brachiocephalic artery. The brachiocephalic will branch out into the right subclavian, left common carotid artery, right common carotid artery, and it goes straight to in here. If you wanna see where you wanna see it. Okay? So that is this is already the right common carotid artery. What is this?
Trachea.
Trachea. What is that? Esophagus. Okay. Now, so here we are.
Which was the esophagus again?
The tube, the muscle there, the big
Oh.
paralleling the trachea. Okay. Now let's move on to here. You see that one? That bean-shaped gland in there? Here. That's the adrenal gland. Close to the kidney. Okay. And what did I say? What arteries are branching from it? You see that these 2 main arteries now? This is the celiac trunk. This is the superior mesenteric artery. And the one that is connected to the large intestine, which is really like a finer artery, is this inferior mesenteric artery. This one. That is connected to the colon. It's almost towards the lower part of the colon. Okay. Adrenal gland, celiac trunk, superior mesenteric artery, inferior mesenteric artery. That's your kidney. This is urinary bladder. This is female. That is the uterus. That's the ovary. Okay. Now, if you are going to clean up, do not mess up the adrenal gland. Is this one? Okay. I told you when you see the vein, you see the artery.
That's
Okay.
right.
So the vein that is connected to the kidney is the renal vein. And where's the artery? This is the artery. See how it's smaller? They're always paralleling each other. Now, this ovary, you see that connection? What do you call the artery from the ovary? Ovarian artery, and the blue one is the ovarian vein. Correct? Now, let us trace now where the aorta go. So this is the thoracic aorta. This is now your abdominal aorta. This is the aorta. You see it? It's a big one. And if you are going to trace it downward, you see now, this is now the two-letter Y. You see that? You see the two-letter Y's now? There. This is now the common iliac artery. This is the left external iliac artery. This is the right external iliac artery. That's the left internal. That's the right internal. You can see the two letter Y's. It looks like it branches like a letter Y. Now, these vessels here on the side, you see this blue and red here? Those are the lumbar arteries. The red one is the lumbar artery, the blue one is the lumbar vein. And you see this artery only on this side because here you may not see it clearly. Okay? So, what else? Oh, this one. That's the liver.
Lumbar, not lumbar.
Lumbar artery. It's not lumbar aorta. It's lumbar artery. Well, this is not. Oh. You see this yellow vessel now branching from the liver? That is called the hepatic portal vein or the portal vein. Okay? And the one that goes down should be here. It branches into two